Okay, good morning, good afternoon, depending on what part of the world you are in. My name is Mercedes. I'm ready from Global Health Network, and I welcome you to the second session of this research workshop here. And now I will introduce you to Maria Elena Patricia. Sorry, from Maria Penaranda. Good morning, good night. Thank you for being here. We see we have many participants, people interested in this subject. Today we will talk about methodology, how to analyze our data, how to present them, and talk a bit more about the difference between impact and justification. Again, we want for you to use your questions so that we can answer them today in the morning or in the afternoon. Otherwise, we can send you the presentations to those who request them. Thank you very much. And I leave you with Maria Patricia, who will make the presentations of today in Spanish. So if you want English, you can listen to the interpretation. We all know Maria Patricia. She is the vice director of research, and she has a degree in medicine and public health. And she is an excellent professor, as you will see today. So please enjoy. Thank you very much, Maria Elena, for this nice introduction. Okay, good morning. Today, we're going to talk about three parts in this morning session. Now, we will explain the justification and impact concepts that should be included while formulating a research proposal. The second part that we are going to see today answers the question of how we will develop our research proposal, which is the development of all the methodological aspects that are key in this process. And at the end, we are going to do a review of the implications of the experimental design to see the validity and the preciseness that is expected here to solve a research question. The part that will take more time this morning is the one related to methodology, because the methods are the ones that put in evidence our ability to understand the research problem and to formulate the goals and objectives with coherence and our capacity to generate valid knowledge that can be reproducible and consistent, and that can be used not only by the scientific community, but also by decision makers in public health and by the population in general. So we will begin now with our justification and impact presentation. When we draft our research proposal, apart from the summary and the title, we will have an introduction to that proposal. So many of us have an academic background, and when we presented or submitted our research for our graduation, we had to propose the problem, justify the problem, and to explain what we are research. But when we're going to formulate a research proposal looking for funding, we cannot put 20, 30 pages that we put there when we include it in our graduation thesis. When we formulate a research proposal, what is required is to have an introduction and the background. And I would like to tell you, based on my experience, that I participated in a PDR call to see the impact on healthcare reform on the control of infectious diseases. And I participated with my teamwork in this international call. And they asked us only to submit 10 to 11 pages. They would say in the first page, or 1 and a half, you should include the background, then the objectives, and 5 to 7 pages of those 11 pages are to develop the methodology. And we remember that when we were studying, the greatest proportion of what we were writing was the theoretical framework. But now when we're writing a research proposal for funding, what really matters is the methodology. So this is why I want to tell you that these are very, very important elements that we have to bear in mind. And in this presentation, I want to show you what elements should be included in the introduction of your proposal. As I said, based on my experience, that the background in an international call only allowed for 1.5 pages at the most to present our justification. So we have to be very precise, and we have to distinguish when we do a research proposal, what is the justification and what is the impact. And we are going to focus on this distinction in this first presentation. So when we write an introduction, it's a page and a half long. It's not more than up to 1,000 words. And here we include elements of literature review, and we include elements of the conceptual, theoretical, and empirical model that have been obtained for the problem that we are addressing, and preliminary results that we have collected from our research journey and our research teams. We have to put them here because it's talking about our previous experience in this research. So for those who are going to review our proposal, and they will base their decision on these results. And then we have to include our justifications and also the novelty of our methods, how we're going to address this research problem. And in the last paragraph of the introduction, we're going to include, when you read a research proposal, generally, it's at the end of the introduction, the last paragraph that clearly shows what is expected to achieve with the proposal that's been presented. And when we talk about the publication, it's this last paragraph that contains these objectives and hypotheses. Because if we see the publications, scientific publications, they don't have the subtitles and specific goals as our degree research work to have. It's different when you have research proposals to obtain funding. As we saw in the past presentation. So when we see all the conceptual part and with the methodological part, it's going to show how we're going to carry out the process. In the introduction of a research proposal, the final paragraph is the one that talks about the hypothesis and objectives, what is expected of our research. So we see here it's derives from the justification of our approach. If we begin with the meaning of the word justification, taking it from the dictionary, this is the Spanish Real Academy. The justification comes from the Latin justificatio onis, which is to explain the reason, the motive of what is being presented is worthwhile, and how is this in agreement with what we consider to be fair. And be able to prove the innocence or the benefit of a person, an act, or a thing, and how we're going to give convincing proof of something. So if we see the meaning of the word justification, we clearly see what's the intention of why a proposal is being proposed. So how are we going to prove that what we are going to do will contribute with knowledge to improve the conditions of life and health? If we have a broader health concept, is good living, as we say nowadays. And if we consider all with the legacy of our indigenous ancestry. So this introduction should have in its justification reasons of why our contribution is worthwhile. So the justification answers to the question, why is it worthwhile to conduct this research? Why our contribution will make a difference uh, to what is already known. In our previous week, we were answering the question to what we are going to do. Now, with the justification that's in the introduction of our research proposal, we're going to answer the question, why is it important to carry out this study? And here we have two key elements in any justification. All justifications should be positioned in space and time, and this space and time is the present. And justification answers to the question, why? But in a specific space and time, and that's in the present moment. It has to be clear that what you're justifying, you're talking about the present time, what is expected today and where, and in what time period, because what's important today may not be important tomorrow, or what's important today in this place maybe is not important in another place. So the justification has to be very well limited in its present space and time to give enough clarity of the importance of what we are presenting. So what answers and these questions that you see here in these presentations that will be available in our platform serve as a checklist to see if your justification, in addition to answering the why, and that it's positioned in the present time and space, this question serve as a checklist to see if your justification contains all the elements that it should contain. Why is the problem important? What statistics, empiric evidence have you picked up in by reviewing the literature and the state of the art that supports your case? And why is this different from what has been done until now? What's the novelty? What is the contribution? What is the novelty in investing in your proposal? What's the difference that it's going to make vis-a-vis what is already known? And what's the novelty and the opportunity, not only for society, but also for the national governments? Now that we have a global pandemic, there are certain concerns that go beyond our borders. So what are the opportunities in our social and context and our territories? That's an important element to justify the proposal that we're presenting. So how in our methods, our proposal making a difference, and how will it contribute to solve or improve the understanding of the problem that is being posed based on a question or a theoretical progress that supports our research. However, the impact, which is the other word that we will see, comes from the Latin impactus, that talks about uh, footprint, an imprint that is marked on us. And it's the effect of an event. It can be an effect produced by public opinion of an event or by intervention of the authority, a news, a catastrophe. And this is limited in space, local, national, global. So the impact is another fundamental or key element of our justification. It talks about the consequences that the research will have in the future and also about possible negative effects on the environment, for example, and how can we can mitigate this or assess the impact that it will have on the society and how can we make society a participant in all these processes. So the impact, differently from the justification, we'll talk about future consequences of our research, and not only favorable consequences, we can have other problems, not only contributions to making the decision-making process, but also negative impacts. For example, we do not dimension what it means to generate expectations in our community that we submit to our research process. So all these elements should be considered when we are talking about the impact of our research in our introduction. We should not only focus on the justifications, but also the consequences that we foresee in the future of our research process. So the impact responds to the question, the second question of this introduction, for what? What are the consequences, the purpose, the final purpose that I foresee when I see in our research proposal? So we have the justification that talks about why it is important in time and space, and the impact. It will tell me what this research proposal will be good for. So you see, we have to have time and space is the present in the justification, but in the impact, we talk about the future. And the impact occurs not only in the economic, social, and environmental setting, but we also have impacts in our timeline. Some impacts can be short term, some can be medium terms, and others long term impacts. So when I talk about a short-term impact, it's a couple of years. Medium, it's up to 5 years, and long-term can be more than 10 years. So our proposal can have short-term impacts or medium and long-term impacts as well. And it can also have impacts on the economic, social, and environmental setting. So in the introduction, when you write your paragraphs related not only to the justification, but also on the impact that your research proposal will have. What for, you have to remember this dimension, the impact on the environment, on the economic, social, and environmental setting, and also the impact in time, if it's short-term, medium-term, or long-term impact. So in the impact, you have to ask yourself, what I expect with the results? What's my purpose? What will my contribution be? And we have to be very concrete and realistic. We can have very large aspirations, but our research has to be very concrete. So where we are going to achieve, because oftentimes you read as a teacher, as a professor, final reports of recommendations and conclusions, and you ask your question, was the research useful to arrive to these recommendations and conclusions? Because sometimes you can arrive to those conclusions without the research process. So we give results and conclusions that were not So for that process was not essential. So you have to be very concrete and realistic. So finally, when you conduct this research, I expect these the impacts that this research will have. What will be the goal and what our limits, and we have to be very realistic.
And the other topic is how I will continue with the proposal. This is essential because there is a phrase that we often listen when we end a research proposal, and the statement is the following: we suggest additional studies, suggest additional on methods, deeper studies. And when you read these phrases, you say, well, ultimately, this is a conclusion or a very truthful reality. I mean, ultimately, which was the proposal? And who is responsible for the research? Who has the ability and the skills to write the best questions? When somebody says that the researcher should be the one that knows the most, you might ask yourself, I need to research the questions that I do not know the answer of. So your research capacity will grow as you deepen your knowledge, and the research impact can clearly and realistically have an impact on the continuity of research work of your proposal, because actually science advances and makes progress, identifies the unknown limits where I can get to, and all of these statements that will be found when we find the limit of what we haven't found yet, the limit of what can be now made available through science and transformation of the conditions society needs. It is really very important to consider within the impact the effects, the harmful effects, the mitigation effects, or the effects that you should consider in the social work environment, and the permits that you should find to carry out these activities. Sometimes we carry out a study that implies to gather biological material, not only clinical patient samples, but biological sample collection. And we need to know which is the environmental legal framework for this activity to have an incidence in the richness of the biodiversity, or how we will approach the society that lives in this environment. There are international standards, SIOM standards, that are the standards that we follow, which are not only the good practice of the experimental studies standards, but also standards that will support us in the participation of these research practices, so that we do not arrive at the inappropriate answer. So all of these consequences and effects in the labor, environmental, and social environment should be considered, and we should be aware of the protection framework of the fact that we have to gather information and we have to protect these environments, the social labor and environment surroundings, to consider these dimensions. So we should always work within the legal framework of those that contribute in research teams. We're talking about impacts that can't be left aside and that are part of the research proposal we have to consider. Another important aspect is that research proposals should contribute in the construction and generate capacity, build capacity, and training processes not only in the generation of new knowledge, publications, software, new scientific development, or new technological development, but also in the creation of human talent, is a very important contribution and is an impact of our research work. But not only that, we have to show an explicit and evident effort of how we will contribute to the appropriation of this knowledge. The ideal scientific knowledge would be to transform this mainstream in the activities of a social group or an individual. And this social appropriation of this knowledge should be included from day one in our research proposal. That is, not only how this will have an incidence on the scientific community, but also how this will be translated, transfer, how will we improve the community science relationship, and how will we broaden the base of knowledge, how this will have an improvement. For instance, if we're talking about vaccination, how will this approach improve equality and access to vaccination, improve the situation of having to cope with barriers in vaccination, but also this is related to vaccination knowledge and us from the scientific knowledge. We haven't been able, and this is a self-criticism, we haven't been able to improve barriers and bridges so that social knowledge appropriation activities are explicit and systematic, as explicit and systematic is knowledge in a publication. So our social responsibility should go line in line with the scientific dissemination of knowledge, so it has a impact on society. So to wrap up this first part of my presentation, we are focusing now on the introduction of the research proposal that you're writing, that apart from having all the background information, all the knowledge that you have of the state of the art and the problem at this present moment, in the final paragraph, you need the objectives and the research hypothesis. You also need to include paragraphs related to the justification and the impact. The justification as the answer to the question why, that answers to a social and a scientific current need within a definite timeline, and the impact in the future action that goes beyond the scientific context and the social contribution this represents, and the consequences that have to go beyond the initial context, not only geographically or in the theoretical corpus, but considering the risks that are included in the research process that need to be anticipated in order to avoid expectations that won't be met. So impact, the expected results, its significance, future directions. How will this project go on? And I repeat this once again. Impact should also mean that in the future with findings, we should take note of limitations, because what we're saying here is that knowledge is advanced when we're truthful and transparent, when we say that the unanswered questions or the other questions that won't be answered in this research process will be the focus of the future. So this is the end of my first part. Great, Patricia. We have one question in our chat. And this is the question. When you talk about impact, do you talk about the research problem impact or the impact on society? We talk about conditions because the impact is related not only with future benefits of the research that will take place when you introduce the research problem, but also consequences that this research will bring about in other areas that will contribute to society beyond the research project itself. For instance, if in a research I will train human talent in health, I will improve competencies of human talent in health, this is an impact that my research will have that goes beyond the research itself. And oftentimes, in different application forms of funding agencies, they recognize a benefit when you say that you will train a PhD student, you will improve capacity in a community. And this part is not included in the introduction. It is included in the final part of your proposal when you need to show which other benefits the development of this research will bring about. And government agencies are interested in the research process that will build capacity. And they explicitly demand this in the final part. That is, which is your commitment with this research other than a publication or improving a process? What is your commitment? And there are other issues, which are the negative impacts that could eventually arise from the research. And how will you mitigate negative impacts? So in the final part, you need to identify potential economic or social impacts that will stem from the research and how you will mitigate them. And now, when we talk about methodology, we will see that one essential aspect has to do with ethics, research ethics, ethic principles in research that are part of the methodology, how these processes will be carried out. And this goes well beyond the basic things, but has to do with the commitment of spreading information so that this knowledge is appropriated. So these impact dimensions are part of the research proposal. Some that are related to the research problem are in the introduction, but other comments are in the end of the research when there is a commitment with expected results and where there are mitigation alternative for potential negative consequences that could stem from the research project itself. Great. Thank you very much for your answer. I think there are other questions on the Q&A icon. Another question. Please, could you elaborate on the impact of knowledge contribution? What is new and why it is not a undergraduate research? When I wrote down the comments that I made on undergraduate comments, I wanted to make a difference between the process when you are in a training process or the process when you are presenting a research proposal for funding for research. When you are an undergraduate student, you focus on the theoretical and conceptual framework, one or two sheets on methodology, and you talk about results with charts. But the focus of the proposal, when you're an undergraduate student, you focus on the theory. But when you are writing a research proposal for funding, the most important part of the proposal is the methodology. I was telling you the story about what happened with a 11-page proposal for an international call for funding. From 5 to 7 were the methodology. So I make a difference here when I talk about graduate or undergraduate proposals. When I want to stress is that these proposals call for more importance to the methodology when we are requesting funding proposal. That is, when you are an undergraduate, these proposals, when you request funding, they will have a very robust methodology. Thank you. Luisa, do you have a question in English?
Yes. We have a question from Cesare, who is asking, how would we scale up our impact from a specific context research project to a more global usability of study results?
Well, the ideal thing is that when you are writing a research proposal, you should foresee how you will disseminate this concept so that you know beforehand that the need of knowledge as a social construct is not the commitment with one community, but is part of the social communication of the concept, and bring this knowledge to citizenship. So the first step would be to consider this dimension when you are writing a research proposal for funding. You have to think about strategies so that these results will go further and beyond the scientific community. And when you're writing the research proposal, you have to focus on this because we have been very weak in science to bring science to society. And that is why we have very complex situations with the pandemic right now. Why? Because scientific knowledge has not been focused on society. We haven't been able to share scientific knowledge with society. So that is why I say that it depends on the proposal. The key aspect is that when you write this proposal, you need to focus on this additional effort so that decision makers and the population and the stakeholders and the target population will share this knowledge. The ideal thing is that there is an appropriation of this knowledge so that it's part of the common sense of a society, common sense of a individual. And this demands an effort of social sciences, but it calls for an extra effort, not only to share the information with scientific societies, but how we will take a step further to share this with society. And this should be made very explicit in the proposal.
I will do
Okay.
another one in English. That's okay. It's actually, it was two questions here. So this one is from Victor, who is asking, is intellectual contribution considered as tangible impact? So there was another question which was already about like, what are the parameters for saying what is an impact?
Okay, there are tangible and intangible impacts. When we include expected results in a research, sometimes a tangible impact is a publication of the research result in a publication that is indexed. A tangible impact is to train a master's degree student or an undergraduate student or a PhD student. A tangible impact is to write an article for public opinion or include socialization actions for the results of the research. All of these are tangible impacts. There are other impacts that in the international scientific community are very much promoted, which are policy briefs. Policy briefs with 1 or 2 pages where you summarize the result so that decision makers, government can use these 2-page policy brief and read the essential results. So the policy brief is tangible, but the intangible thing are the processes that science or a research line will carry out throughout time. This is untangible. The important thing here is that the tangible impact in the expected concrete results should be part of the research proposal. And I'm not talking only about scientific publications. I'm talking about explicit effort to perform activities that will contribute to the appropriation of this scientific knowledge in community, because we oftentimes focus on publishing the research result, publish an article, but we don't focus on having an impact on society. Patricia, can I ask another question? Javier asks, in social projects, it's very difficult to measure social impact. What is your recommendation, Maria Patricia? Yes, it is. It is difficult actually to measure impact. You can measure or consider it from the epidemiological perspective. That is, when we measure epidemiological impact in a disease control or in the decrease of mortality rates or in the improvement of customer satisfaction of healthcare services, other variables. But there are some that are difficult, which are social processes of the research process itself. When communities participate, when there is a possibility to change knowledge, attitudes, community practices, these are other elements that could be considered. There are impacts that can't be measured, as for instance, a liberation process in a community that organizes itself to improve their living conditions or political participation. So these would be very difficult impacts to measure. All impacts are not tangible. There are some impacts that will be very difficult to measure, but we need to have a cross-cutting approach because impact measurement is a complex task. And as a complex task implies the participation of all stakeholders, but there is a joint social response. We should consider also which is the assessment of our research. The important thing is to remember that impact should be considered when we write a research proposal. This is not an easy question, but we always need to consider that, well, this research proposal, what is the ultimate goal? Which is the ultimate contribution? And if we explicitly ask this question, we will have some tangible impacts that will help us make progress and that will make this research project worthwhile.
Thank you so much. Sorry, can we go ahead with one last question? Perfect. So it's a question from Gilbert. And
yes, the last one, because I need to start with my next presentation. Great.
Yes. There is a question here, which is there a recommended way of developing research impacts from your justification? How congruent do these two elements of your proposal have to be?
Well, the relationship of these two elements in the introduction of the proposal, that is the justification, answers to the question, why is this important now in this present moment in the timeline of the proposal? And impact is future consequences. Impact should be included in the beginning of the proposal and at the end of the proposal with expected results. And negative impact. How would you mitigate negative impact that could be generated with the proposal? So the research answer is answered with these two items. So in the introduction, the importance of the problem in the present, in concrete terms of the answer of the research question, that is, at the present moment, in the space where the research project will be take place, are the paragraphs that are related with the justification and future considerations, future prospects. This is part of the impact. But the impact is also part of the last part of the research proposal when you write the expected results and the economic, environmental, or social impact expected in the short and medium term. So the justification goes in the introduction, and impact part is in the introduction, and part is in the expected results at the end. In the methodology, which is our next topic, we have the ethical aspects that are also related to the mitigation of possibly negative impact. But I do not talk about impact itself, but I'm talking about ethics, ethical aspects in the methodology that are closely related to the whole of the research process, which needs to have an internal consistency from the moment in which we ask the question and to the moment when we request for funding. So in the introduction, we have the justification, impact, answering the problem, and the methodology, ethics, related to the consequences, and in the final part, expected results and mitigation of future products that I tangibly expect from the research.
That the methodology is essential in the research proposals. When you're looking for funding from financial institutions, because the methodology answers how I will carry out my process. And if I have that clear, I show my capacity, my capability that I have for the team or the group that's presenting the research proposal has to conduct the proposal, the process, and it generates the trust. It is reliable, and that it will produce valid and consistent knowledge. So the structure of the methodology is one of the essential parts of a research proposal. And we will see now the parts that make up this methodology. This scheme that you see here contains all the phases of a research proposal. The financial entities have different formats, but regardless of the format that these institutions have, one must have selection, analysis, and exposure of a research problem. Also, search of state-of-the-art search of the literature. Also, the wording of explicit objectives, and say how I'm going to do it, and in what time, and what budget, and how I will administer the project and use the results, which have to do with the impact that we saw now, and also a summary of the proposal. As you can see, all of these components, the first session of this workshop talked about elements of the first part, such as how to conduct a selection and also present an analysis of the problem based on the problem tree, and what are the elements that we have to look for information about the research problem. Now we're going to focus on this box here, this gray box. How are we going to present the research methodology? That means, how are we going to conduct the project, and what are the parts of these methodologies? In the next session, we will see the components of the other parts of the proposal, but now we're going to focus on the methodology. So here we have an example. Some authors like Hooley, Cummings, Browner, Grady, they publish a book about clinical research design. And here they show an example of what they call the anatomy of a research, or the plan of the study. And I will use this example so that we can focus on the methodological part of our research. This methodology is the one that says how I will conduct the process. And it has to do with the research questions, which is what questions will the study address, also in the introduction and the importance of the study. So the justifications tells us why these questions are important, as well as the answers. Also, the methodology design, the temporal frame, and when, and if it's a epidemiological study, how I will structure this study. We have much evidence comes from exact sciences, natural sciences, social sciences, and also you also have to consider epidemiological studies. But to see how we will structure the study, we'll see this in detail here. Another essential elements are the participants, how I choose my participants, what are the selection criteria, how I select these persons that will be part of the study, the variables. So how can I make these concepts operational that I want to understand empirically? So what are the variables that I will study? If they are quantitative values, how are we going to do these measurements? But also in qualitative studies, how will I capture these responses? How will the interactive process will be, or the how will I gather all the data to improve the understanding of social phenomena that are not quantified? These are more analytical categories or concept categories or theoretical constructs that help us to improve the understanding of a healthcare problem. And also the statistical aspect, the hypothesis, the size of the sample, how many people will I invite to the study, how will I select them, and how will I analyze the results. This we will talk about next week. But with this example of the anatomy of research, which means to plan a study, these are the answers that we have to provide in our proposed research proposal. So I will focus on the components of a research methodology. The first component of research methodology, and this we can consider as a subtitle that you can use in the research methodology in an explicit manner. The first one is the type of study. What methodological strategy will I select to address this research question? The second subtitle is the population and the sample. So who will be part of this process? Individuals or experiments or cell lines or cultures or experimental situations or population, secondary analysis, census data, data in the network. So who and what sample will help me to capture the phenomenon? Who will be the target of our conclusions? There will be the second subtitle. The third subtitle is what techniques and data collection procedures will I use in this study. And the fourth subtitle is how will I process and analyze the data, be them quantitative data or qualitative data? What are the ethical considerations? How will I ensure a benefit? How will I avoid risks? How will I be fair in achieving a balance between the benefits and the risk of my research process? And I will know if this methodology will work. These 6 elements are the subtitles of the research methodology. And so we will begin with the first one, the type of study. The type of study is the strategy that I will choose to do my research. In the epidemiological study and quantitative designs, I have 3 questions that will help me to select the best research strategy to address a problem. If I only want to answer what happens, uh, I need variables of individuals, time, and space. What group, human groups, what age groups. If I only want to get to know the subject, I'm talking about exploratory or descriptive studies. So if I'm only going to answer what happens, I need individual variables, time and place variables. The best strategy is to use an exploratory or descriptive study. Okay, now I know what happens. This is what's going on. The magnitude of the pandemics is such, the risk of dying is this one, and being hospitalized in an intensive care unit is this one. What treatments are required are these, but I want to know why some do better than others. So why is mortality different from one region to another? Or why the COVID vaccination coverage is different between countries? So now I begin to ask a deeper question, is why is this happening? So when I want to answer this question, why is this happening? We need analytical studies. And what characterizes these analytical studies is that they conduct analysis. All studies conduct analysis, but the feature of analytical study is they try to construct the comparison scenarios between those who have or those who don't have, who have high coverage, low coverage, high mortality, low mortality, who are exposed, who are not exposed. When I build scenarios that allow me to compare, then I can answer why things are happening. So I use this strategy. If I know what happens and I want to build scenario to compare different situations to answer why things are happening in such a way, then we have analytical or a comparative study. But once I already know why things are happening, I can build hypotheses explaining why things are happening in the way they are, then I can go on to a next step. I can go to the next level, which is to see how I can conduct an intervention. How can I implement a certain measure? How can I design an experiment? So this is a more of an evaluative assessment of what we do. So here we look at an action that I want to take, and I have to assess if this will have an impact or not. These are other type of strategies. These are the intervention and experimental studies. In epidemiology, the cause is a very important concern, and we have addressed it through analytical and comparative studies. Now we have to do more interventional research to, to see what is happening and what the impact of the different actions or omissions will have on the healthcare process. So when we want to see the impact of the measures that we take, as was asked now in the previous presentation, this type of presentation are known as interventional or experimental studies. So the first elements to choose the research strategy depends on the questions. If I know what happens, then I build comparison scenarios to understand, to answer the question, why this is happening, to see the reasons, or the interventional experimental studies when I want to intervene, when I want to implement an action to change the process. So I said that the type of evidence for this type of research strategies comes from epidemiological studies. We have different types of evidence. Descriptive, for example, to see qualities or distribution of variables, as we see in exploratory studies, or taxonomic evidence, because it helps me to classify or define profiles to look for features that will allow me to characterize a phenomenon or a human group. We also have analytical evidence that's looking to the cause-effect associations in a comparison scenario where I can formulate hypotheses and I try to verify them. And we also have an interpretative evidence that is done based on the phenomenology or social sciences that help us to go deeper in the interpretation of the results. And this is essential evidence to answer the complexity of the health processes. And then we have the evaluative evidence that allows to determine the relevance, effectiveness, and consequence of the activities. Right now, we have a lot of research on the implementation of measures because in healthcare context, we have interventions and we have to assess the effectiveness of these measures, and the gap between the controlled interventions and the real world interventions, this gap here we have the research of implementation. So what should we do so these things that we know that are good in real life should work and should contribute what they are expected to contribute. So to design the strategy, we have a lot of types of evidence that not only come from the epidemiological character, it can come from any of the sciences and disciplines of human knowledge and that are not limited only to the healthcare processes. In a study case book, who the author is Robert Jean, he has this table here that I share you here. That's very interesting because it talks about how to select your research strategy. You have to see, you have experiments, populational studies, case studies, archive analysis, and historical studies. But according to the question that you formulate, if you control or not the event that you study, and if it's focused on a current event and the type of control that you have on the study variables, all that helps you to understand what strategy you should use. For example, if I formulate of how and why, and I can control the event, I can do an experimental design, especially if it's an intervention in a certain population. So here you can use an interventional study or experimental study.
And if I want to answer how, who, what, how many, I do not need to control the event. But if I focus on current events in demographic studies, the studies that we have in our countries in national health studies, could give us an example, and I'm being redundant here because this example serves as an example, but it tells us how often these national health surveys are carried out in our country. So these are examples of these types of studies. Now, case studies, these are processes that I want to research. I'm not talking about individual persons. I'm talking about cases, a series of cases, but also more complex social processes that answer how and why. And these case studies are interesting methodology, alternate strategies to deal with this topic. We don't need to control the event. We're talking about current processes. And I talked about the call for funds that I participated to analyze the effects of sector reforms in the control of infectious diseases. It's a case study where we analyzed the reform of the Colombian health system to control TB. So this is the methodology that gave us the possibility to deal with this complex event. The event is a reform with all the complexities that are included in the reform of the public health system with TB. So we developed a case study methodology. The file analysis. Now we have access to so much information, reviews, systematic reviews, meta-analysis, reach assessments, topic reviews. So these archive or file analysis of existent literature, of existing studies, this is a possibility to answer who, why, where, how many, how often. So currently, we are carrying out an evidence study to analyze the possibility to resume face-to-face classes in school, university, under the current scenario of the pandemic of the Delta variant of SARS-CoV virus. So we're talking about the different variables and consequences. Is this a safe move? Should we do this or not? And event control historic studies will give me an answer to how and why are another research strategy. So this is an example of the text I made reference to in the beginning of my presentation. And this shows how my research question, which is eat fish, eating fish, does it have an incidence on heart deficiency or ischemic heart disease? So this is a cohort study that analyzes fish consumption in different subpopulations and the relationship and incidence of fish eating related to ischemic heart disease. So we have the cause and the consequences and see where there is or there is not a relationship or any clinic assessment that talks about calcium level in coronary arteries, or it is a cohort study. It's a cross-cutting study, but I can also carry out a control case study with cases and controls where people that are admitted with acute myocardial infarction, when they are admitted in a health center, I separate these cases from other patients that are admitted or come to the healthcare center to see whether they do or do not eat fish. So the same question can be used for different strategies, or I can perform a randomized study in which I give fish oil to a group of persons and compare it to a placebo to study whether there is a difference in the incidence of heart disease or ischemic disease in these two subgroups. So you can see that the research question depends on the level of knowledge you have, the type of question that I want to answer, but actually there are many possibilities because there are many different strategies. An important part that we need to consider, and this is the focus of my part of the presentation, which is the beginning of a topic that has to do with mixed studies, the complexity of health events. When we have to decide the methodology approach, we will not always have the possibility to answer the health problem made in the question with one methodology. So we have quantitative and qualitative methods. And this has to do with a very deep epistemological debate. But these two methods should be used together to deal with healthcare problems. So qualitative methods should be considered in research. Now, if we talk about qualitative methods in experimental studies, quasi-experimental studies, or we have observational designs, experimental designs, which are the longitudinal studies, the cross-cutting studies, the analytic studies, or the combination of different designs. For instance, a case and control study in a cohort that we follow with fertile women or teenagers, suicidal attempts in the teen population. So I can combine different quantitative methods for my study question. But we need to start thinking about the integration of these different areas of social sciences to give an answer to the health disease problem. So now what we're currently doing is design different approaches as the grounded theory design, ethnographic design, narrative design, phenomenological design, action research design, or designs that put together different types of designs from the perspective of the qualitative approach. For instance, you can see in the screen the approach that we could give to a heart disease study in a Framingham study in a subgroup population from the United States. So chronic disease knowledge and non-communicable disease stem from the follow-up of this population. Look at how interesting. The beginning was an exploratory approach. Little was known about heart disease at that time. Then they followed with a descriptive study. Then they evolved to a study that would establish correlations. And in 1967, through these correlations, they started to relate obesity and heart disease. We're talking here about 1967, last century. In the 70s, there was a relationship between diabetes and heart disease. So as time goes by and as knowledge advances, methodological strategies also progress. In 1970s, there was a connection made between lipoproteins and triglyceride and heart disease. And in the 90s, we see competing risks, environmental factors, lifestyle, biochemical markers, genetic markers. All of these factors are now part of the analytic research that accounts for these causes. And we can carry on. There are many interventional studies and very complex studies that use evidence in different ways. So, descriptive studies, as I said in the beginning, are the following. We use the variables person, time, and place. Like, for instance, is the case of case studies, case series, or surveys. These studies help us create the hypothesis. A descriptive study establishes a relationship, and numerically, in the analysis of descriptive studies, this relationship is based upon a population expressed with a denominator. For instance, the ratio. What is the malaria ratio between malaria and falciparum or other parasites that cause malaria? When we talk about P. vivax, what is the relationship with falciparum? So there is a ratio, a relationship on a malaria type caused by P. vivax or falciparum. And we're talking about a HIV transmission gender, or we can establish the suicidal attempts comparing men to women. So these comparisons give me the possibility to study these subgroups, or we can study which are the ratio or the percentage of deaths of COVID patients. So I can establish a relationship if I study a subpopulation, which is the percentage of deaths. This would be a rate per X million inhabitants, how many patients died of COVID-19? We are talking about the speed of the problem as it affects my target population. So these descriptive studies try to identify these fraction numbers that relate a phenomenon to a population. And the important thing here is to consider that if I want to talk about incidence or prevalence, I need to have the population context. If I analyze the complications in a hospital or suicide attempts and patients that come to a healthcare center, what will I relate these events with? Not all teenagers that come to the hospital have this situation. Will I compare this to teenagers that come to the hospital or teenage population? So I have to very specifically limit the scope of incidence and prevalence. So we need to consider in these descriptive studies representative samples that participate in studies when we want to decide the prevalence or the incidence. If I will use a demographic or population basis to my conclusions, I need a sample that will represent this population. Or on the other hand, I can just say which is the frequency of persons, but I do not have the possibility to translate this to all population if the sample in my descriptive study is not representative of that population. That is the target of my conclusions. Environmental studies are studies that are correlational when we establish geographical areas. For instance, vaccination coverage for COVID-19 per country compared to COVID-19 mortality rates. So there is a comparison, vaccine coverage and mortality rates. And I can show inequalities to vaccine access or the circulation of certain strains compared to coverage in other locations. So I can aggregate the variable of the endpoint, which would be in this case, mortality rate compared to mortality, comparing vaccines in all geographical areas. So these ecological studies make more progress than descriptive. They can generate hypotheses, they can establish correlations, but they do not necessarily help me identify the cause of these problems. So cohort studies are national health surveys. For instance, breastfeeding surveys, nutrition surveys in population, food security in a population, and at the same time, they analyze if there is or there is no exposure and what does and does not include the endpoint. For instance, smoking or the use of addictive substances. These surveys start from a representative sample of the population, and at the same time, I can analyze the exposure to different things with different endpoints. It is a cohort study because I start studying the endpoints and possible causes. The disadvantage of these studies is that I don't know anything about the background information to the exposure of an event. For instance, these cohort studies include, for instance, national health surveys that can study statistical relationships, but not time causal relationships. In case control studies, as I said before, we have Birmingham's study. We have the study I mentioned about heart disease and the intake of fish, for instance. So we're talking about endpoints. We have control studies with a group that can be used as a comparison, comparing exposure. In social sciences, these studies are known as ex post facto studies, that is, they're retrospective studies. There are different studies that are carried out about verbal analysis of families that have a suicide case, comparing other families that do not have suicide cases and comparing these outcomes, which is so difficult to face and cope with suicide. That is a strategy with control cases. So I perform a study and retrospectively, I try to identify an explanation, a reason why, and I compare this to a group that did not live the situation. So for instance, if we're talking about mother death, for instance, maternal death, there are some control case studies that help me. After something has happened, I can retrospectively analyze which are the facts that can account for this event, as is the case with maternal death. So there are many studies that, depending on what I am being compared to, and depending on how I choose the comparison group, this can introduce a lot of bias in this case. And it would be very interesting to come closer to the explanation of many events, which are essential. Other studies are the studies that are the cohort study, which are the populations that have a common population, which are longitudinal throughout time. They are prospective when carried out for the future, but it can be a retrospective cohort study if I have information on, for instance, pregnancy. Pregnancy is a period in which I can analyze what the situation is with pregnancy and perinatal mortality or mother-child situation during pregnancy, which implies follow-up in time to analyze in this population group if there is a response to a specific risk that arises in this situation. So these are the cases that are called cohort study. So I have a situation and analyze if during time there is an endpoint that requests for a follow-up.
Another type of study are the interventional studies or experimental study, where I begin from populational study. I define criteria, selection, exclusion and inclusion criteria. Those who have exclusion criteria are not included. They will not participate in the study. And the potential participants, there is always to have the will to participate. You cannot conduct an intervention study without having the consent of a child, for example. The informed consents will depend on the age and of the norms of each country. But if a child has more than 7 years where we have use of reason, then we can have informed consent. But that, of course, that's for adults, but childs over 7 years, they can consent to participate in a study to study, for example, intervention for intestinal parasites. I don't only ask the parents or the professors of the schools. I have to ask the consent of the child if they are older than 7 years. So all interventional studies have to include the consent of the participants. And that can be in a collective manner, with community workshops where you're going to have populational interventions. Those who do not accept to participate, they will not participate in the study. And those who accept and give their written consent, then they are invited to participate in the study. And then we have a randomization when it's a clinical trial, or they can be randomized to one or the other alternative. When I have a randomizing process, I do that to avoid biases on assessing the outcome variables. If I do that, we're talking about an experimental study. But if I don't do this randomization assignment of the intervention and only do the intervention, then I have an experimental or an interventional study, because I'm not doing a controlled randomized assignment of the intervention. Of course, if I cannot deny a benefit to a population, I will ask oral authorization to using placebo. I cannot do that, so that would not be ethical to do study with placebo when studies have shown that the alternative is very effective. This is a summary table that separates the observational studies from the experimental study. The observational studies here observe the features of the populations, and the experimental ones, I have these in study of the interventions. The examples of observational studies, we have the descriptive, analytical studies, the ecological, cohort study, control and case studies, and the experimental ones, we have the clinical trials, the field trials, and the community intervention studies. In community trials, we have different ways of doing this approach, and we have other names for this type of studies. And we also have a series of advantages and disadvantages of each one of these studies. Here, when we're talking, for example, of rare diseases, then we have to have case control studies or epidemiological studies. But and if we have rare exposures, like in Chernobyl, the exposure to radiation and its effect on different transformations, then we would have to think in here, we would have to have cohort studies. We have cohort studies that allow me to identify multiple causes. I was talking about the Framingham study, but studies facilitate identifying multiple causes, like in a case and control study, possible explications for suicide attempt. This is based on young people that have certain exposures that can be compared to controlled studies to look for different causes. Then we also have the temporal relationship. Here we have the cohort studies because it allows me to have follow-up and to assess the incidence of a disease. But some healthcare problems require a long latency period. For example, exposure to oil, to see if there are impacts in terms of leukemia or other diseases due to working exposure. This long latency studies require case control studies to be able to assess the impacts in terms of neurological diseases. We have a lot of studies that are hybrid. We have a combination of different study designs. And we also have systematic reviews and meta-analysis. The meta-analysis, they study all the studies that have generated evidence. Here we're talking about the evidence pyramid that it has different sections that you can see here with this magnifying glass. You have case control study, cohort studies, randomized controlled trials. Here you also have the systematic reviews and the meta-analysis studies are the magnifying glasses that allows us to see all these studies. So meta-analysis comes from the social sciences, and it was taken or incorporated by the medical sciences. So with this meta-analysis, we can see different authors with different methods. So the meta-analysis goes beyond one single authors and see the concepts of different authors. This was denominated as meta-analysis in the social sciences, and this term was taken by the biomedical sciences to be able to conduct a review of the evidence generated by different studies. And this is a way to combine all these results. Those systematic reviews and meta-analysis are the tools that allow us to gather all the evidence in the literature in a systematic and critical manner. The experimental studies, as was I said, they require a randomizing process. This is what we call them randomized control trials, RCTs. These are the trials that are used to prove efficacy in control situations of drugs or other interventions. So if you have a control study, you have to assign the intervention in a randomized fashion. In community trials, you cannot do this because you cannot deny a benefit. So the ethical implications of these type of studies have to be considered carefully. We also have field trials with people who are free of the disease that come from the general populations. These are the field trials, especially in phase 3 trials. Here we are, for example, testing COVID vaccines. These are field phase 3 trials because phase 4 is post-marketing, and this is pharmacosurveillance. We also have community trials in the sense that they are used to measure how an intervention, to measure the impact of an intervention that's applied not on individuals, but on collective groups. So here we have randomizing to groups like schools, streets. You know, here we can see the efficacy against malaria, for example. So when we have studies that's not on individuals, we're talking about community trials. And we have the quasi-experimental studies that do not have a randomizing process. Here we have before and after studies with an intervention and without intervention. I can compare the before and after. I can compare simultaneous comparisons between groups that received the intervention or did not receive the intervention before and after. This quasi-experimental study for many prevention programs and health promoting programs are designed that allow me to assess or give me the efficacy and the efficacy, not the efficacy because I'm not talking about randomization, but it allows me to see the effectivity and the impact of some in health promoting interventions. Here we have a table, a figure. You will see that in your slides, where we have a characterization of how quantitative and qualitative studies, how they are characterized. And it's good to bear this in mind. You're going to have this as a reference because the trend is that qualitative designs be incorporated to quantitative studies, to do a triangulation of the data from different perspectives. So now the ethnographic studies, the grounded theory studies, they go together with quantitative evidence to be able to explain all the complexity of the phenomena. And it's what we know as mixed design. So the complexity of the problems make us tend to have more methodologies with mixed designs, with qualitative and quantitative components. The mixed designs combine several methods. It can be from a same approach. For example, if you can have a case and control study in a cohort study about chronic renal diseases. So we can see that there is renal failure that are not caused by diabetes, but by people who are exposed to certain working conditions like high temperatures. Here we see renal failure. That was something that was not observed before in young people. So if we have this in a country, we're analyzing the situation in Panama. We have a cohort of transplanted patients. I want to see which of them had renal failure that could be explained by non-traditional factors like exposure to certain working conditions like high temperatures, compared to risk factors that they develop renal failure like diabetes. So this is a combination of case and control studies within a cohort study. And I could combine quantitative and qualitative methods in a concomitant manner. So you do a study that approaches qualitative and quantitative aspects, or do a sequential study. So I began observing qualitatively what's happening with suicide attempts among young people, and build a series of categories, and then I do a survey with the students. So I do a sequential process. I begin with a qualitative process, and then I continue with quantitative process, or the other way around. Or I can also do a qualitative study that will give me elements for posterior quantitative studies, or integration designs of different research process. So we have to think that the methodology of our study should include the combination of different designs to be able to better explain the phenomena that we are studying. So this is for the first point. So the following points, we will have the talks next week, but I want to highlight these points of the methodology that you have to bear in mind. In population and sample, we have to answer from who we're going to collect information. You have to consider, if I'm going to select somebody for a survey, who am I going to call? I have to define a study population. I have to know how many people I will invite to the study and how I will select them. Because in the sampling, we have to know how many people, and we have to know how to calculate the sample size. We're going to see this in another opportunity, but we will know not only the size of the sample, but what estimate errors we commit when we do not have an adequate size. We have to know also how we're going to select the individuals, because if I only invite my friends, the likelihood that they think like me is very high. But I want to show the diversity, the heterogeneity of the perspectives. So the way I select a sample, I can introduce bias. And we have to consider this in a research methodology. Who I will invite them, how many, and how I will select them, and from which population. And a very important element that I was mentioning now is that the sample has to be a representative sample. And this representativity, not only from the statistical point of view, we have to represent the features of the populations, but also it has to be adequate for the phenomenon I am studying. If I have to approach the family history of individuals that have presented mother mortality, then the representativity is not only a problem of the deaths that occur due to pregnancy in a population, but also I need to know the reproductive healthcare conditions of the population in different social classes. And this representativity has to be not only statistical, but also qualitative representation. So to know who I have to select, we have to have maternities or with different family history or different access to the healthcare services or different cultural, social differences uh, in face of pregnancy and childbirth. So here, when we talk about representativity, we're not only talking about statistical characteristics that I have in a sampling of a study, but this representativity also has to be thought or conceived to reflect the understanding of a phenomenon when I'm doing a qualitative approach, how I can gather different features of this event that I want to get to know profoundly. So I have to have different settings that have to be represented in my qualitative approach.
In the sample, there are bias possibilities. A bias that brings me closer to what is easier, but not necessarily what is the target that is voluntary or patients that come to the healthcare organization. And this is very interesting in healthcare services. As for instance, you look for healthcare centers to assess customer satisfaction, user satisfaction, and ultimately, those are the ones that do not use the services are the ones that are more critical with the services. So if you only include users or patients, will not always talk about the quality of the institution. Maybe somebody that never came to the hospital will talk more about the quality than those that are admitted very often. So we need to think about that how I will invite somebody to participate in a research process can include different types of bias. Now, with relationship to the third subtitle, the third item, we need to be very explicit when we want to explain the techniques that I will use to gather data. Maria Elena presented this in the first day, and she talked about that the question should lead me to an objective, a variable, a method, and an analysis. And I need, in this logical sequence, to explain how I will measure and how I will analyze data that I consider for this investigation, not only the analysis of quantitative data, but qualitative data as well. Under which perspective will I gather information? Which are the techniques that I will use? How will I guarantee the process? And this is the consequence of the objectives and the problems and the variable, which is the characteristic that varies. If I want to research, are we human beings or are we not? Us here participating in this workshop, yes, we are human beings. There is no variable. It's a constant variable. So what gives me heterogeneity, what gives me the possibility to show the heterogeneous nature that gives me value to the research, because to answer a constant result, we don't need a variable. Heterogeneity, variability is the one that needs to be represented in a research process. So that's why statistically, variance, variation, heterogeneity, sampling, error, estimation errors that could capture the heterogeneous nature of the phenomenon are essential in decision making to choose appropriate techniques to gather information and techniques for the sampling process. Well, data sources can be variable. We have available information, which is low cost information. We have observation techniques that are used in social sciences. We can see whether a participant or a non-participant, we have to consider the ethics, whether I am studying or observing facts in a blind manner without the informed consent of the subject. I need to communicate these processes. We can have different approaches and techniques like interviews, individual or focal groups, written questionnaires that are related to the third subtitle. How will I gather information for my research project? There are many biases that can be introduced in the way we gather information and that we need to consider. For instance, the lack of standardization of our instrument or observable partiality. For instance, if we're analyzing the young population and you put me in charge of the project, maybe I will not the best person to have a approach other than yes, no, normal, because I'm an adult responsible for gathering information about the young. So we really need to consider not only the instruments, but also who is the person responsible for gathering information, because this can introduce a great quantity of biases, and how we train and skill those responsible for gathering information, because the attitude that you have will reflect the way an interviewer gathers information. You need to consider this to prevent these types of biases. And a very important thing is that we need to notify biases with honesty. Of course, there is a limitation in the gathering process. So you need to say that you standardize information up to such an extent, but that a certain bias was not controlled due to such and such a reason, or that you couldn't have access to such a population, or that you couldn't standardize information from that team, or sensitive information was not identified in the first sample of interviewed persons. So we had to perform a snowball sampling up until the moment I could really clearly identify the problem. We should also consider whether data gathering procedure can perform physical or emotional harm or damage. Because if a study generates anxiety or changes a behavior, and if this anxiety makes my blood tests or biochemistry tests an altered result, this should be important. So when we gather information, we should consider these potential biases. When we gather information, we also need to consider the fact that we should add a section on data management. We need to see how we will work with the different agencies that will give you information on which are the plans and which are the responsible parties for information gathering. Will you use informed consent or not? Do you need consent of communities or authorities to participate in the study? How will you save data? How will you guarantee confidentiality of information? And how will you guarantee truthful and reliable value of data that can be reproduced? If measured under similar conditions, will we arrive at similar results? So this has to do with the design of these researches and repetition of experiments so that we have consistent observation results. Processing and analysis is related to all statistical analysis techniques. And the important thing here is to consider not only which is the validity, which is the truthful value without biases or mistakes, the independency of information and independence of the possibility of arriving at conclusions. If I can generalize or translate these conclusions to another population. And this is called representativity. If I do not have data obtained from representative populations, I cannot translate or extrapolate my results to a different population. That is the reason why, in my analysis, it's essential to consider the validity of results. And this is what takes place in the real world and what takes place in the study and what takes place in the findings when I am producing my research work. The study I plan, that is this current stage in this workshop, we're planning my study. When we design a study, we need to have the possibility to infer results of the research question that I am writing and infer this, giving me external validity. When I plan my study, I can infer my results and transfer them to a population. And this external validation will depend on what? On representativity of my sample. But there is another validity that has to do with internal terms. That is to say, how comparable is this? How do I choose participants when I design my study and when I have my results? Which are the different inferences I can do with my study population? And what is the internal validity of my study group that I chose my comparison groups well? But if apart from that, I can have the representativity of an external population, we're talking about external validity. So my conclusions will be focused towards something. This is an essential component when we analyze data. Apart from validity, I need precision. That is, repeated measures that are consistent in my estimates that will reduce errors when I am repeating experiments with the randomization of my experiment. But for the precision of my estimates, I need to know which is my sample size. There are different strategies to decrease or reduce error produced by random in my measurement approaches, how I standardize observers, how I improve an instrument, how I optimize teams, how I repeat measurements to have a different look to see whether my information is consistent. So in my analysis, I always need to consider not only the precision that talks about the possibility to reproduce information, but the exact nature of my information that talks about the validity. Validity that will have the same value in different measures and the exact nature, that is, that I have proof, sensitive and specific proof that there are no false positives, that there are no biases. The best way to assess precision is to analyze repeated experiments and see whether there is consistency in results, comparing this to a reference standard. Precision is very useful in a study because it increases the power to identify results that is related to the sample size. And validity is important because conclusions can be extrapolated. If we talk about external validity to the general population, if we're talking about internal validity to the groups that I compared in my study. And what about the precision of a randomized study? We have the observer, the participant, the measurement instruments that affects the exactitude or validity because the bias will put me further removed from the exact value. And this systematic variation of the truthful value. For instance, the observer will only say, no, I don't want to tell the truth. I want to tell you what's socially acceptable because I want to participate in the survey, but I will not tell the truth. So there is a instrument and participant bias. We need to consider these biases because these biases will remove me further away from the true value. Information gathered has to be classified. I have to verify the quality. We need to decide which statistical software platforms I will use to process the information. All of these elements are part of the methodology. That's why in the beginning I said that the methodology is the core of a research proposal because it should explain clearly that what I will study in my research is a truthful problem. And if I consider all of the aspects that can affect me in the truthfulness of the results of the instruments that I propose. We also have ethic connotations. We will have Maria Lena, which is one of our faculty, that will talk about ethical aspects. Please remember that ethics has to do with confidentiality, aspects, safety, autonomy, and the justice principle amongst those that I invite. And I cannot, in my groups, have groups that will take risks and other that will only have benefits. So there needs to be a balance in my research process. And in the previous analysis of methodology, it is very important to make a difference between a pre-trial. For instance, if I will test my instruments, it's a pre-trial or pre-test. But if it's a pilot test, the pilot test needs to include all of the stages of my methodology. If it's a pre-test, it's a component, an instrument, a process, one part of the methodology. But when I talk about a pilot test, I talk about all of the steps: selection of participants, information, analysis, samples. So the pilot test is more comprehensive because it includes the different stages of my methodology. And the pilot test gives me the possibility to go over my method, contributes to further analysis of the logistics, to make final adjustments, to save time, effort, and money. So when you make your research proposal in the methodology, you need to include how you will prove or test the methodology. Will you perform a pre-test and a pilot test? Will you test the instruments, or will you have a pilot test in which you will test the methodology in the whole of the process? So these are the subtitles of the research methodology. This is the part of the structure that I wanted to share with you in this presentation on methodology. Going over research methodology has 6 subtitles: type of study, strategy, sample, population, who will participate in my research process, how will I gather information with this research methodology, which are the techniques and procedures that I will follow, how will I analyze the information I gather, how will I fulfill ethics principles, and how will I prove that this methodology works, that it's reproducible and valid. So all of these subtitles should be part of my research methodology. And the objective of this research proposal, you can write a checklist considering all of these elements so that you can verify and check whether all of these elements are part of your research proposal. So this is my final comment on this part of the second presentation for today. And the experimental design presentation is an invitation to think about the controlled conditions, the ideal conditions of my experimental design. That is the situation that we have in the research project, considering these elements so that they can guide us in the research methodology, which is qualitative, and if it's not experimental, should fulfill certain principles. So I will share my screen now to start our last presentation on experimental design. And we will go over these very few slides. It is important that experimental designs in research projects gives me the possibility to control our research design, because reality is so complex that we cannot include everything in an experiment. But when we talk about control conditions, we need to consider certain characteristics that will be used to develop a discipline in the scientific research approach. So first, when I'm designing an experiment, I have to consider the main answer variation causes. I hope to control these conditions. If I am running an experiment to, for instance, analyze growth of a plant, for instance, or if I want to assess the need of supply to assess the conditions of a crop, I need to consider the weather conditions, humidity, and environmental factors that can alter my answer.
I should find control conditions in an experiment so I can get the ideal pattern of the response that I'm assessing. And I have to compare these response to the different levels of factors that I control. And I should build models that allow me to predict the response. So in an experimental process, I have the factors that I can control and factors that I cannot control that can change this outcome. So what do I aspire to consider both the inputs and the controllable factors and have information about the uncontrollable factors to be able to adjust for the outputs to adjust the outcomes. There are a series of significant definitions that we have to include in our experiment design. One is the response variable, is the outcome, the feature that I will measure, and it's what we also know as the dependent variable. So what is the expected outcome if I'm studying the response to a treatment to reduce in a certain period of time or in a shorter period of time, for example, asthma crisis with an inhaler to have the fastest onset of action, and there my dependent variable is the time in that I require to reduce bronchoconstriction. So that's the response that I expect as an outcome, to have a short response, a short onset of action in an asthma crisis. So I have an experimental study to compare different inhalers and the response in an asthma crisis. That could be my experiment. The factors are the variables that intervene, independent variables that are related to the response. And these factors can be observational or experimental variables. In the case of this example, to reduce the time of an asthma crisis, this experimental variable are the inhaler A versus inhaler B. But we have other observations, other factors that are observational that depend on the patient. It's not the same thing to see the response to an inhaler of someone who has chronic obstructive pulmonary disease to see the response in a child that has an asthma crisis only. So to see his response. So see that the response to the same substance will vary due to other observational variables. It can be when we have chronic obstructive pulmonary disease, we don't have a response of the alveolar tissue because it's a rigid tissue. It doesn't respond the same as a child that has a more healthy alveolar tissue. So these are other factors different from the experiment that are inhaler A and B or inhaler 1 or 2. We have other variables that are also related to the possible outcome. So we have factors and response variables. In the factors, we have experimental factors, but we also have other factors that can have an influence on the response. And these factors have different levels of measurement. Here we have the category or the variable of the situation. The experimental unit is the smallest part that will be exposed to the treatment, regardless of other units. And it is where we observe the response. The experimental unit in our experiment, in our example, is not a culture, like a type of fertilizers and how they affect my yield. It can also be an individual or an adult or a chronic obstructive pulmonary disease or a child and the response to the treatment given by an inhaler. The control group is the group that I will use to compare. In asthma crisis, I cannot have a group treated with placebo. I cannot leave an adult or a child without treatment in an asthma crisis. So we have a controlled treatment. So we compare inhaler A and inhaler B. As I said, the same thing with the COVID-19 vaccine. Right now, we have to using placebo is not adequate because we have vaccines that have shown efficacy. So I would compare one vaccine to another. So the control treatment is the comparative treatment. If in the case of a plant, for example, using one fertilizer or not using a fertilizer, that's okay. But in this case, when we're talking about people, we need a controlled treatment. That will be the comparator. And the measurements are the measurements that we'll do about the dependent variable, which is the outcome. And also we will also measure the independent variables. And the independent variables are not only the ones related with the experiment, but also observational variables that can have an influence or can change the outcome of my experiment if I don't have them, consider them. An important part in designing experiment is the experimental error. This is a key part to conduct research in a controlled setting. We have to control these variations in the independent variables. And I have to consider what are the sources of experimental errors. So here we have to consider if we have natural variations, for example, height, humidity, do we have variability in the way we use the instruments? The instruments have to be well calibrated and standardized so that we can measure the response adequately. If there's a possibility to do repetitions to be reproduced responses to see if an instrument is giving me consistent results. And we also have interactions with other treatments or other conditions that may change the response to the treatment that I am assessing experimentally, or any other external factor. So as in other sciences, you know, we always have to consider and anticipate potential errors that can be included in my experimental design. This is a great advantage because I can define a protocol to conduct the experiment and see how we'll approach the potential causes of experimental errors. How can I mitigate these causes, and how can standardize or adjust these outcomes with additional information to have valid conclusions? So every time you design an experiment, these are the checklist questions. How many experimental units do I need? The size of the sample? How do I assign the treatments? How many factors should I consider? If it's necessary to group different experimental units in blocks, and how many repetitions I have to conduct to demonstrate that I have reproducible outcomes. The number of factors, you can have uni or multifactorial experiments. You can have balance or unbalanced repetitions between groups. I can have a randomization process that can be complete or partial, and also the selections of the factor levels. They can be fixed, randomized, or combined. See that if I'm going to talk about two factors in a study that considers factor B and a factor A to experiment, and these two factors have two different levels of measurement, see all the potential results that I can get. In this case, it's 2 at the power of 2. But if I complicate the situation and I include 3 factors with 2 levels of measurements, but I also include factor A, B, and C, see the complexity of the potential results that I will have in my experiment. So if I have more than one experimental factor, I make the more complex the number of possibilities of the outcomes and of the analysis. When I conduct the experiment, we have to consider, while collecting data, the randomizing mechanism, how to manage the measurement instruments, how to manage the standardization of environmental conditions. We have to see the formats of the data collection, and also if we're going to conduct a pre-test or a pilot test, where in the pilot test we have to consider all the phases of the experiment while conducting it. The 3 elements of an experiment are randomization, if it's going to be complete or partial, or it will be limited only to a subgroup of units. And what are the goals is to avoid the bias caused by sources of variations due to the non-controllable factors, and also tendencies of the investigator to favor certain groups. And also the objective of this is to have a more independency of the data. So the randomization will free me from the bias and will allow me to better compare the 2 groups. Repetitions, how many times I have to repeat the treatment, how many times I have to repeat the experiment to measure the variance or the experimental error, or have a better precision in my estimates. And while repeating the experiment, how many times I have to repeat it in a laboratory study, for example, it would have a mirror in the size of the sample to conduct an experimental study. So now how many individuals I require to see the true reduction in the time of asthma crisis. I have to compare them enough number of people, comparing the response to inhaler A to inhaler B. So how many times I have to submit how many childs and adults I have to use in my study to see if one inhaler is inferior to another or if one is superior to another. How many people I have to include in my sample to achieve valid results. The control of the experimental error, it's essential so that the conclusions can be valid. And it's not only a statistical task, but also the investigator has to know the problem that is being studied to be able to eliminate all the conditions that may induce that type of error. We saw all the sources of experimental error when we initiate an experiment. This was my presentation. I did not want to make it broader because what I wanted you to see the concept of the implications of controlling an experiment so that we can have valid conclusions when you do your research. So now we can open for Q&A. Thank you very much, Maria Patricia. Well, the first question from Diana Garaiva is, according to your experience, do you believe that there are a preference for a specific study behalf of the financial institutions? Well, financial institutions, they have expectations. They expect something from a study. And while you go forward in generating knowledge, they prefer, or the descriptive and exploratory studies will be more local. It will be more for the local populations. But if I see analytical and comparative studies where I see some hypotheses, or I generate new analysis theories, or I do intervention studies, so as I do progress and I collect evidence, we will have more preference from the funding institutions. But it also depends on the problems. You know, if maybe it's an unmet need and you have to begin from the basics, the financing institutions are aware of that and will give funds to improve that knowledge. But if it's a problem that has been described in terms of individuals, place, and type, or I know why we have certain features, a financing institution will prefer to fund an analytical study to a description study. And if I want to intervene, I want to do research of implementing an intervention to collect evidence, then the financial institution will prefer to give funds to a study that collects further evidence, higher level evidence. But if the society is benefited much more by a certain study or benefits the scientific community, then you have a higher likelihood of receiving funds from the financial institutions. Javier asks, do you know, the correlation does not define definitive evidence, but it indicates the trends, the example, for example, that you presented. So what could be the indicators that reveal correlations that allow us to take preventive actions? Will that study take many years? Well, those factors, these correlation studies, the correlation has one feature. They don't define a dependency causal relation. It says that one thing is correlated or increases proportionally when something else happens, but it doesn't mean that one is the cause of the other. No, it doesn't define that you have an outcome and the other one is the cause. These are two phenomena that I address to see if there is a correlation, but maybe there is no causal relation. That's one of the fallacies that is made with this type of research. The fallacy of this type of research has to do, with, I can arrive to conclusions from one correlation that do have no applications, or I can take evidence from one population, extrapolate that to another population with no validity. So the valid correlation validities help me to elaborate hypotheses, but they don't help me to define what is the dependency relationship dependency relationship between two variables. What is the cause-effect relationship? That is a fallacy. This is why the correlation studies are characterized as descriptive studies, because they help me to generate hypotheses, but not to prove them. So to make more progress or make strides from an ecological study to one that shows associations that may allow me to establish the causal relation and measure the impact of an intervention, you have to make strides in other type of study designs to have more solid evidence, and that will take longer. Perfect.
Carmen Palta is asking, a cohort study can be retrospective? Yes, a cohort study can be retrospective, and the main recommendation in this case is that you have information of the previous exposure before outcomes. For instance, retrospective cohort studies, mostly published, are labor exposed population, because I have information on when the person started working, which are the different positions when this person started this contract or working in this task. So we fulfill the premise that I have information on the previous exposure of the outcome. I can, for instance, analyze in oil companies what are the characteristics of accidents and which were the hazard conditions exposed to workers. So these are retrospective follow-up, but it's not me as a researcher that followed the cohort, but rather I used company information and I have the date in which this worker was exposed to this hazard, how much time he or she spent in a position. So this is a retrospective cohort, but I have to make sure that I have information on the previous exposure before outcome. Great, great, fantastic. And it is great that we have time to answer all the questions that our participants are asking. So thank you very much, Maria Patricia, for answering these questions. Ingrid Lorena is asking, which is the difference between mixed and translational studies? Well, the research of translational studies, I beg your pardon. I mean that word is a translation. Translational studies is a translation of knowledge in the basic science, and I take this to translational medicine. What is translational medicine? How you translate basic science knowledge and how you apply this in clinic. So there is a translation of a concept to an applied concept. So when we talk about something that is cross-cutting, we say that when it's a translational study, you translate a result to applied action. But when it is a cross-cutting, study, you can understand the complexity of studies. That is the difference. Great. Javier is asking, in the previous presentation, you said that we have very bad translating scientific knowledge in society. There are many things that need changes. How can we improve this from research and academy? Well, we as researchers and members of the academia, we take responsibility, we take social responsibility in this issue. If we bear in mind that we as researchers should be participating, not ourselves personally because we're not specialists, but if we involve in our teams those that are specialists in economic, environmental, and social aspects to have a more comprehensive approach of the complexity of processes, we will be able to bridge this gap with very specific aspects and activities. When we write our research proposal, we need to ask ourselves, what will I do to go beyond this research, to take a step forward so this is owned by a community through social communication techniques or how I will socialize the results? At least have this as a question: which are the resources, budgetary resources, that I will allocate to try to translate this knowledge into our society? So if we start with this concern, we will make progress because the gap is very wide and the distance in this pandemic really showcases that there is a widening of this gap, and we will collectively overcome situations where science should fulfill the purpose of science itself, which is to serve communities. I remind participants that the questions that we can't answer right now will be answered in writing by Maria Patricia and Maria Elena and will be posted in our webpage. Michelle Rivera Rodriguez asks, is it possible to perform a mixed study, which is a prospective correlational study, answering what happens and why, or mixed studies are only qualitative and quantitative? Yes, it is possible to perform or to write a mixed study of different studies. There are different stages that I need to explore, but if there are stages in which I have previous knowledge, I can correlate data. For instance, if I have a kidney transplantation cohort study, I have a cohort and I can include a case control study because I want to study the cases that we have in the young populations with controls of the rest of the participants in the cohort. And I can include a case control study in the cohort study. They're both epidemiological, quantitative. One is follow-up study, the other one is case control study. I can include this and I can mix them. So not only I have the possibility of using two methods in qualitative and quantitative, but also we can also mix or have hybrid designs, including one design in the other. And I can also use different information techniques. I can use different techniques to gather information. For instance, a survey or a standardized questionnaire that can be combined with a focus group to have more in-depth information on the most frequent results of the quantitative. If we use different methods and techniques to gather information, are almost required because these problems are very complex. So one single methodology or one single method or approach will never provide a full answer to the problem. So we have to combine methods and information gathering techniques to answer these questions. Great, Maria Patricia, fantastic explanations. Now, Luisa will ask a couple of questions in English.
Hello. So here we go. There is one question from Dolapo, who is asking, When a cluster survey is conducted within an existing demographic surveillance system, is this design explorative or could it be case control?
Well, let me see. Cluster and conglomerate studies have an advantage. You don't need a large geographical dissemination, but within the cluster, you need to find the diversity. So a cluster could be a case study, a descriptive study, where you have selected the sample in the cluster sample. It is more than a case study. A case study does not look for the statistical representation and the heterogeneity that a cluster study gives me. A cluster study implies more statistical approximations, and a case study is a rather complex phenomenon. For instance, when you analyze the healthcare system answer to the pandemic, this could be a case study because it has a more broad analysis categories from a concept perspective. A survey or a cluster gives me a quantitative answer and talks about the heterogeneity of the phenomenon in this cluster. For instance, national surveys or demographic surveys have complex samples with different stages where you randomize different clusters so that numerically quantitative, you can prove your assumption. For instance, a case study and the cluster study have different methodologies and would arrive at different conclusions. The cluster study is a study with statistical representation, sample size, and selection that should be fulfilled to arrive at the conclusions.
Thank you. So Olivier is asking if you could please clarify what is the difference between repetition and replicates, those two concepts that were used during the talk.
I use them as a synonym. The number of repetitions is the name of replications that I have in a study. They are synonymous. But reproducibility as a characteristic of a study is different from repetition. I need to repeat measurements to show that they can be reproduced, that my results can be reproduced. And these reproduction in English would be reliability. This reliability requires repetitions. So reliability has a different meaning. It has to do with consistency. That has to do with different studies and repeat measures to account for something that scientifically can be reproduced so that we can use this in similar contexts, but in different places will have consistent results. So repetition is an action that I consider in my experiment. How many experiments I run to arrive at a result. But reliability as a scientific condition talks about the consistency of my results when I perform studies in similar conditions, even though it might be in different places, so that a research is scientific. The scientific nature needs to have both characteristics. It needs to be valid with no biases, but that it can be consistent and I can reproduce it. If I repeat it under similar conditions, it should have similar results. That is why when we assess a methodology, the methodology should be so explicit that anyone that wants to repeat the protocol can follow exactly the same steps that you listed in the methodology and have consistent results. So in this sense, the reliability is a characteristic that goes beyond simple repetition. You need to follow steps to have consistent results. If I follow these steps in the same way, that is why in scientific evidence is important, not only not to have biases, but to have consistency in results. And the methodology will give me the possibility, if I follow these methodology steps, to see whether if I have these conditions, and if somebody looks at this protocol, and if somebody else follows these steps, they will have similar results. This is a critical moment to assess a proposal that can be consistent, that can be reproduced following the steps that you explained in your methodology, and that it is valid, that it has truthful value, not affected by biases. One other question, yes. The question by Paula Andrea. Health ethic committees demand that pilot tests have their paperwork done and their support? Well, let me clarify this. A pilot test can be run with a purpose to verify whether your methodology works. And I can do this before approval by the ethics committee to prove that my methodology, for instance, in the inclusion of participants, etc., will work. But if I am including participants that will be part of the studies in the future, that I need a written informed consent, I cannot run a test pilot without an informed consent of my participants. So it will depend on the reach of my pilot test that I will need the informed consent. I cannot invite people to participate in a clinical trial and I say, okay, this is a pilot test, so you do not need to fulfill any ethics principles, you don't need to give me your informed consent, and I run a test pilot. No way. You need to have all the approvals of the ethics committee. But if my pilot test includes different aspects that have no implications to generate any expectations, or I want to check how my staff will do this and that, or check methodology without requesting any informed consent, ultimately it depends on what type of test, because for instance, with the excuse that it is a pilot test, I cannot skip ethic principles that should be fulfilled. No way.